Yeah, it's not morning.
It's not morning. I was waiting for you to say good morning. It was like, it's 1 o'clock, Crystal.
Uh-huh. It is.
Mm-hmm.
You ready?
Sure.
Okay.
I just want relief from my stress.
I don't know how to dance to this. This is too slow.
Have a bunch of people to impress. I just want relief from my stress.
That was a little too fast.
I just want relief from my stress. Late nights.
Oh, God. I need something that goes faster next time.
Well, to be fair, though,
I know there's not really
Like-
anything.
neither one of us had heard that song before.
Oh,
But it goes with what we're talking about today,
true.
which is what?
Inappropriate urination in cats.
Super excited. I hope you guys are all excited.
Are you gonna do your? You want to save that for the end,
I think,
or you want to do it now?
I think let's keep people in suspense for a little bit. So I will say, though,
Yeah.
if you share the video, comment that you shared under the post, because we had a couple people that shared it, and I don't know if you just don't want to be entered in for the free candle, but everyone likes free stuff. So if you share the video, comment that you shared it, so that way we can see that, because some people's privacy settings won't let us see if they shared it. So you need to comment that you shared
So
it.
it's weird because it'll tell us, it'll be like, oh, there were 6 shares. And we're like, great, cool. Whose names do we put in for it? And so we hit that button, and then it just lists like 3 people, and that's it. I'm like, well, it said that there were 6 shares, but there's only it doesn't match up. So we don't know. Facebook betrayed somebody.
It did.
So,
But I think it's got to do with their privacy settings, and maybe it's not something that you're even aware that you're not sharing, but we can't see it.
we
So
can't see you.
if you're sharing, just comment that you shared, and you have to do it on the original post, because if you comment shared on someone, like if you share someone else's and then you comment shared there, we can't see that either.
Sure.
So just make sure that you comment on the post. So, and if you're popping on, say hello. If you have any questions about inappropriate urination in cats, let us know, and we'll try to
But
answer
don't
them.
ask inappropriate questions.
Right. Did I weird that? Did I say that weird?
No,
Oh, okay.
no, I was just being weird.
Well, you're always weird. So, okay.
So let's see. So inappropriate urination in cats, meaning what? What's inappropriate urination for those people that might not know?
They are not going in their litter box
Yeah.
or wherever you're trying to get them to go.
Right. Yes. So a very common issue that we see in cats, unfortunately, and there's different reasons that they might do that. So what are some of the most common reasons that we find?
UTI, so they've got an infection.
So bladder infection.
Stress.
Mm-hmm.
Maybe you adopted another animal that they don't like. Maybe you had a baby or small children, something of that nature.
Okay. Just stress in general.
Yeah.
Mm-hmm.
If they are having other kind of issues, well, I was going to say diarrhea, then they're not using their box.
Yeah.
But that's not really.
We're just focusing on
inappropriate
urination.
Yeah.
Not
So-
elimination.
Yeah.
What else, though?
They could have a stone.
Good job, Crystal.
I mean, I think that, yeah.
Because it doesn't have to be a UTI to have a stone
Yeah.
or a stone to have a
You can have
UTI.
any, yeah.
Oh, yeah. Yeah. So, how do we diagnose these things?
We are going to check some urine.
Yeah, so that's usually
We're
our
running
first
analysis.
our first step. So, I guess technically that's second step. So first step is getting a really good history of what's going on. So having information on where are they urinating, where is your litter box or boxes, what types of litter are you using, what style of box, how many cats do you have, is your cat indoor, outdoor, indoor only?
Have you switched up the litter?
Have you changed things recently? How often are you cleaning your box? How often are you scooping your box? You know, there's a lot of history questions that go into this. So that is a big help. And that kind of falls into, I think we've talked about before. If the person that has this information could be the one to bring them in, that would be amazing.
Yeah.
Because if we don't have those sorts of answers, that makes it a lot harder to figure out what's going on and narrow down what's going to help. So those, all those history questions, they are important.
So now, is it a medical issue?
Mm-hmm.
Is it something that you're doing at home?
Mm-hmm.
If it's something you're doing at home, maybe we try some of those things first,
Mm-hmm.
so it can save you money too.
Mm-hmm.
So we don't have to run a urinalysis and try to get urine from your cat that probably isn't going to pee for us, or doesn't have a big enough bladder that we can get urine from them. So it can save you money too.
Yeah, exactly. So so after getting the history, and that we then, typically will want to check some urine. So normally for cats, the way that we obtain a urine sample from them is with something called a cystocentesis. So what that means is we actually take a needle and syringe and suck a urine sample straight out of their bladder, which I think a lot of people, when they hear that, they're like, ooh.
Horrified.
Ooh.
Yeah.
Actually, the cats,
they do really
awesome. Well. Yeah, they don't really generally seem bothered by that at all. I think they're more opposed to having to lay on their backs than anything else. Like the needle part is cool, but having to lay on your back in this little foam trough thing, that's what's offensive. Yeah. But there's a couple different reasons why that's our preferred urine sample. So because you could bring in a urine sample if you're able to get one. That's cool too. And that's certainly better than having nothing sometimes, but it's not an ideal sample because in cats, because there's so many things that cause these urinary symptoms that are not always infection. And in fact, I think infections are a very small percentage of the cases. It's important to have a sample that is a very clean sample. So when you suck a sample out of like a litter box or off the floor or the sink or wherever, that's going to be contaminated. Your environment is not sterile. And so there's going to be bacteria in that sample. And so then that can make it more difficult to determine, is this bacteria because that's what's living in their bladder, or is this bacteria just from the environment? So that's why we like to have a very clean sample. So if we take a sample straight out of the bladder, that is as fresh and as clean, so fresh and so clean, as it could possibly be. Because then too, depending on what we see under the microscope, we may want to culture that sample. And if it's something off the floor, you can't, you're going to grow something out of culture.
You can culture it.
You can culture it.
You
physically can, but it's a waste of time and money and energy. And then there's just no reason to do that. You're going to grow something and it's not necessarily going to be really what's causing an issue. So it's really going to confuse things. So sample straight out the bladder. That is our choice. So the other upside to that is we typically use an ultrasound probe to look at the bladder, find the bladder, and then we know where we're poking because we're not just like blindly poking on your cat's belly. So that too, we can see some different things inside the bladder. So we can look at the thickness of the bladder wall. We can look and see if we see any stones. Sometimes it'll look and we can tell there's going to be crystals in there because it'll look like a really pretty snow globe. Yeah, it's really cool. Not cool for the cat, but it looks cool.
Yeah, you just kind of.
Yeah, you just kind of bounce on that belly and it's just like, ooh, so pretty.
It is pretty.
Or masses, if there's a mass in the bladder, it's something that we can potentially see as well. Our ultrasound certainly is not as good as the radiologist's, but we can see bigger things. So that's kind of nice too. So now we're evaluating the bladder itself for signs of inflammation, like a thickened bladder wall, or the stones or the crystals or whatever, and that gives us more information too. So it's like putting all these puzzle pieces together. So then with that urine sample, what do?
We will take it, and there's a few things we do. We can culture it if you decide that that's something you want to do. We run it through a machine, and you can do this manually under a microscope, but we have a fancy machine. That takes pictures of all the different fields, and it'll show us white blood cells, red blood cells, like epithelial cells, crystals if there's any in there, and bacteria. And then we will also do a strip that tells us if there's glucose in the urine, ketones, white blood cells, or is it just red cells it's just blood cells in general?
I think it has a spot for whites versus reds, but it's super reliable for that.
Yeah.
Yeah.
And then we also look at the specific gravity,
Which is what?
how well they are concentrating or diluting their urine.
See. Yeah. So if you have an animal that's drinking a whole lot of water, that urine should be very watery. And so we can tell that with the specific gravity test. Whereas if you have an animal that's dehydrated, that urine should have a lot more other stuff in there and less water. So that's more concentrated. And so that helps tell us things too. If we're evaluating for like kidney function and things like that, that's an important thing to know. So the urine can also help screen for things like diabetes. So like Crystal said, the dipstick will have sugar in there or glucose if they're diabetic. It can screen for kidney failure or kidney disease. And we can tell some of that based on protein levels in the urine or the concentration of the urine. So the urine's magic. It can tell us all kinds of things. It's very exciting. Very, very exciting.
Why are you so excited about urine right now? Okay, weirdo.
But yeah, so tons of information from that. So so that's why that's our second test, or first test, second step in determining what's going on with the pet. So based on that, so if we're seeing like a whole bunch of
Sleepy.
am I boring you? If we're seeing a whole bunch of red blood cells but no white blood cells, what might that mean?
That there's not an infection.
Yeah, probably not an infection. Whereas if there's a ton of white blood cells in there, now we're leaning more towards something that's an infection. So just because you see blood in your cat's urine, that doesn't mean that they have an infection. They can, that's certainly one of the possibilities, but not always. Because cats get a condition called feline lower urinary tract disease, or FLUTD. FLUTD, F-L-U-T-D. So basically, and that's gone through a few different name changes. They'll probably change it again in the next 6 months. Who knows? But basically what that is, so the bladder's inflamed. And the wall is thick. It's pissed off. There may be blood.
You can't say that on the Facebook Live.
I did. I'm sorry. There's
We
probably,
can't bleep you.
drop the F-bomb or something. It's ticked off, okay?
There you go.
So the bladder wall itself is thickened and inflamed, and so we can see blood either constantly or intermittently in the urine. But when we actually look at it underneath the microscope or in our fancy little machine, what we'll see is there may be a high number of red blood cells in there, but there's really few to no white blood cells. And then if we were to culture that urine, and I usually do, if I'm suspicious that it's FLUTD, I usually think it's a good idea if we have a cystocentesis sample of urine. I think it's a good thing to go ahead and culture it and just make sure there's not something that, like, maybe the body's just not fighting it off. Maybe the immune system's not working so good. So culture that. Make sure that there's no growth on the culture. So if there's no growth on the culture, that means there's not bacteria there. And so that tells us that is a sterile cystitis. So cystitis just means inflammation of the bladder. And sterile meaning there's no bacteria there. So we treat that very differently. Antibiotics aren't going to do anything for them. Right? That's a waste, and that's creating antibiotic resistance and wasting money and potentially causing side effects that animal didn't need that medication. And so that would be why typically we don't do antibiotics for those guys. It just doesn't do anything for them. There's no bacteria for them to be, for the antibiotics to treat. So instead, what do we do?
Usually pain medication.
Mm-hmm. Why?
Try, because it still hurts.
Mm-hmm.
It's still painful to them. They still feel like they have a UTI.
Exactly.
It's just not something that we can treat for with antibiotics.
Yeah, and so I think that's an important point as well with the FLUTD cats. They're not just being jerks. It's not like, I think people, it's just behavioral. Well, it kind of is, and we'll get into that in a second, but it's not, they're not just being rude or angry or, upset. It's actually a physiologic response. That as far as that cat is concerned, they feel exactly the same as if they did have an infection. So if you've ever had a bladder infection before, is very uncomfortable. And you feel like you have to go very frequently and you're straining and it's not a good time. And so that's why they're peeing outside the box and in different areas of your house, because they keep having that urge frequently. And whether they pee a lot or just a little bit, it's just,
Like you mentioned, you may see blood in it,
Mhm.
but that doesn't mean that there's an infection there.
True.
So yeah, we'll treat them with pain meds.
So pain meds. And then depending on how long the symptoms last, most of the time they kind of get over it on their own within 5 to 7 days. But sometimes we have ones that are just having a harder time getting over it. And then we need to do some other medications or some different environmental sort of changes. So let's talk about fluted and what causes fluted.
I'm going to say hi to Jen real fast because she
Oh.
said hi to us.
Hi, Jen.
Hi. So stress
Mm-hmm.
is a big factor in that.
Mm-hmm. Sure.
So, like I said earlier, you get another cat, you get a dog, you know, maybe
You move, somebody moves in, somebody moves out.
yeah, maybe your kids have new friends coming over, and now your cat is hiding and getting stressed out.
Yeah,
That can-
construction in the house.
Yeah.
A new cat that's wandering around outside that you know, it's not even in the house, but they
Yeah.
can sense that and they know, and they react to it. And also, you know, honestly, a lot of the times, I don't think we know what the underlying change was because they are so much more
Maybe you
sensitive to
moved their
certain things.
bed, or
Well,
you moved their box.
Yeah, exactly.
It could be anything.
There's so many things. And so, you know, because that's usually one of the first things people tell you. Well, he can't be stressed. He's spoiled rotten, you know, or whatever. But there's something that they're reacting to. There clearly is. And I can tell this because they have this condition. And that's what causes this condition. So even though we don't perceive what the change was that caused these symptoms, there still was something. So obviously, if we can get down to, oh, we figured out what caused it and it's something we can fix, great. That's your best bet. Like, oh, I moved the litter box. It's not, you know, in the bathroom anymore. Now I put it in the laundry room. And oh, hey, you know, when that washer is on the spin cycle and it's making all that noise, that's stressful to your cat. And now he doesn't want to use his box.
Especially if he was in the box
Especially if he was in
when
the
it
box at the
happened.
time. Yeah. So things like that. Okay, you know, we can narrow that down and we can fix it. Great. And it's not something that we're going to be dealing with lifelong. But other ones, you know, they're just high anxiety cats that need a little help long term. And so typically we need to do a couple different things. We need to do not just medication, although medication is certainly a good place to start. So things like Prozac or Xanax or, you know, sometimes certain supplements can help. But also a multimodal approach where we are also trying to address environmental needs. And it's something where, okay, maybe we were doing things that were less than ideal before. Maybe we weren't scooping the box every day and they were fine, you know, for 5 years or something, but now we have a problem. So now's the time that we got to step up those sorts of things. And so, you know, whereas things weren't a problem before necessarily, but fixing those things could certainly help now. So no judgment, you know, my litter box doesn't get scooped every day.
No.
You know,
I mean, look at it this way. You got 5 years of not scooping the box every day.
True.
So
True.
now you just have to do it a little more frequently.
You just gotta do it more frequently.
That's why I have multiple boxes for my one cat, because they don't get scooped every
There you
day.
go. Yeah, and so, you know, that's, like I said, and as long as you're not having an issue, okay, you know, whatever, no judgment. But when you start having an issue, now it's time to fix those things. Yeah. So multimodal approach, meaning, you know, litter box care, environmental enrichment. I'm sorry. Sorry, it's a boring topic for you. I'm sorry you're not as excited about urine as
I'm not. Plus, I think cats are just jerks anyway most of the time.
Well,
so
they are jerks, but that's not why I'm peeing.
Well, no, that's not what I'm saying. My cat in general.
Yeah.
He's a jerk.
He's just a jerk.
Yeah.
Yeah, but there's, you know, different toys and working out that prey drive that can help, having perching items. And there's a really awesome website, I think it's called indoorcats.org, I believe, that goes through all these different aspects to look at and think about and start, providing for your cat. Because I do think a lot of people get cats thinking, it's a cat, it's easy. Here's the box, here's some food, here's some water, you're done. And that's all you need. But they do require more than that. So they need interaction, and they need toys, and they, so many things. So there's something to kind of go through and think about and look at and try some different things and see what helps. So that's fluted. Do we have more to talk about on fluted?
Other than just like there are stress plugins that you can get to try to.
Oh yeah. Pheromone diffusers can help with that too. Yeah, and it's important if we put your cat on medication. A lot of the medications that we use for this take a good 2 months to reach full effect.
Yeah.
So don't give it for a week and then you're like, this isn't working, and then just stop giving it and never call us.
It's definitely something you have to work with. It's not going to fix itself overnight or even in a couple weeks. It's going to take some time.
Yeah, so if you're getting frustrated, let us know, and there may be something else that we can do while that's kind of reaching full effect. Sometimes we'll kind of do a combination of medications for the first month or two, just so we have something that's short acting and then something that's for more long term, just to try to get you over that hump. Because I get it. It's terrible.
Yeah, it is frustrating.
That's awful. I can't imagine having my cat pee all over my house. That would be it smells. That stuff's like permanent. It's terrible.
Yeah. But then if you try to block them off to like a bathroom or a bedroom, that's just going to make it worse.
Exactly.
In most cases. So it is frustrating. Absolutely.
Yeah. So on the other hand, so let's say we see the urine sample with a bunch of white blood cells and we culture it and it grows something. So that would be a UTI. So urinary tract infection or bladder infection, whatever you want to call it. So then we will do antibiotics. And there's different antibiotic options, and depending on what grows and stuff, there's certain things that are better than others. We usually also try to factor in what are you able to do. Because while ideally we would do medication by mouth,
not always
doable.
Yeah.
And so sometimes
a pill or a liquid work better if you are going to do it by mouth.
Yeah.
Cats are hard.
Can we do nothing by mouth? And so we need to just be happy with some kind of antibiotic and hoping for the best. That's fine. Maybe the long-acting antibiotic injection is the way to go. So, those are things that we try to discuss with you. And then after that, it is important to follow up. Just because the symptoms are gone doesn't mean that the infection is cleared. We need to follow up and recheck a urine sample and make sure the infection is gone before we let it get back out of control. Because if, we recheck in a week and that infection's not gone, but maybe it's better and we just need to continue for a longer course, or there's no difference and so we need to switch medications, do something different, that tells us something. Or if it's all clear, great. So if it's all clear and then, another couple weeks later, hey, they're flaring back up again, that tells us something too. Now we're starting to look for some underlying causes for why they're getting bladder infections so frequently, because that's definitely abnormal. Whereas if you didn't follow up, I don't know if this is a new infection. Is this the same old one? Was it ever better? I don't know. And so it makes it really difficult to figure out how to proceed and what's going to be best that way. So if there's no fluid and there's no infection,
stones.
Maybe stones. Yeah, and so hopefully
I do get excited about stones.
Stones are cool. So hopefully we're able to see that with the ultrasound, but not always. Some of them are teeny tiny, and so we end up needing to do an X-ray to look for those. It just depends. But yeah, so stones are certainly a possibility, and if there's bladder stones, what do?
Surgery. Well, not always.
Take them out.
Sometimes.
Usually.
You can dissolve them with food, but
yeah. So usually surgery.
Yeah, most of the time when they get to that point.
And because truthfully, get them the heck out of there and get them healed up. They're going to be healed within a week or less if we go in surgically and remove those. And so then that means their symptoms are going to be gone in a week or less. Versus if we try to dissolve the stones, that can take many months. So that means they're still peeing in your house for many months.
And they may not dissolve.
And they may not dissolve. And you may have to do surgery anyway.
Yeah.
That's my theory. Just do the surgery. Get them out of there. But,
yeah.
I get it. Not everybody wants to do that. It's not always feasible for everyone. But, yeah.
Yeah.
So what else? What other things would cause inappropriate urination? Let's say urine looks.
Ooh, maybe they're an intact male and they're spraying.
Yep. So
Is that
get
what you
him
were looking for?
neutered.
Yeah. Okay.
Get them neutered. Yeah, exactly. Or, of course, too, if we checked urine, it wouldn't have been normal urine, though. And it was showing signs of, like, diabetes or kidney failure. Those are things that we would then pursue blood work for. But, yeah, assuming it was normal urine and they are spraying. So not all inappropriate urination is spraying. We get that term used incorrectly a lot. What's the difference?
So urine, they're actually like going to the bathroom. Spraying, isn't that more of like a marking type thing?
Yeah, and how can you tell the difference, do you think? Do you know?
I
Put me on the spot.
don't really know. I'm assuming they like go like back up to something.
Yeah, so it's
spray.
typically more vertical surfaces.
Yeah.
Is going to be your spraying, whereas like if it's a horizontal surface like a floor or a couch or those sorts of things, that's going to be just inappropriate urination.
Yeah.
So that's your big difference.
And male cat intact male cat urine.
It's awful.
Especially when they're adults.
Oh my god, we had those ones in, when was it, last week or week before last?
Yeah.
They were just here for surgery for like half a day, and I was like, ooh,
Yeah.
it stinks in here.
Or there was a couple like probably close to a year ago. It was like when I first got here. It was so bad. Like the laundry room here smelled because there was some stuff in the washer already, and so we had to wait for that cycle to end, and they had peed in those blankets. Do you remember that?
Yeah.
The whole laundry room smelled
Terrible.
Yeah.
You can definitely tell the difference between intact male cat urine
That's what my mom
and
says.
anyone else.
You don't want a male cat in your house. And I'm like, but he's neutered.
Yeah.
Like
they're
I
neutered,
think
they don't smell like that.
Yeah. I'm thinking you're thinking of an intact male cat.
Yeah.
And you're correct. I do not want that in my
I mean,
house.
Yeah, cat urine's stinky, but when it's an intact male, so much worse. So much worse. That's terrible. What else you got? You got anything else that we need to cover with inappropriate urination?
I don't think so. Other than Crystal's just look really pretty under the microscope.
You were gonna say
What?
Crystal looks really pretty, like you were talking about yourself in the third person.
Crystal looks really pretty today.
Pretty
Wow.
today. Oh.
Look at me. Look at her.
We are wearing makeup today, which is unusual.
We are. Yeah.
We took some pictures that, well, we took pictures like for like the website and things like that. But we'll share some outtake photos of that later.
That's because she's not in any of them. That's why she's gonna share
pictures.
There's some real gems.
They're pretty fun.
So
I'll share one or two of those.
Yeah.
So I think that's all I have for inappropriate urination in cats. So just some things to think about, talk to your vet about. Definitely not a condition to blow off. And because the longer that you wait to address it, the worse it's going to be, and the harder it is to correct.
I thought of something we need to talk about. Male cats in specific, if they have stones. If your cat is trying to go to the bathroom and nothing is coming out, that is a medical emergency. They need to be seen somewhere ASAP.
Yes, immediately.
Yes.
Not like, I get off work at 5, I could be there around 5:30 or 6. No. Nope.
Because what's happening is there's something blocking so that urine cannot come out. And so their bladder just keeps getting bigger and bigger and bigger. And it can actually rupture.
Yeah, because they don't stop producing urine.
Yeah.
So, yes, that bladder can rupture. And so then that is immediately life-threatening, and that's bad.
I've seen one cat die from bladder issues.
Yeah. And even addressed quickly, we can still get some weird electrolyte imbalances, problems with their potassium and that can affect their heart. And so, having to sedate them to place the urinary catheter, that can be a little dangerous, but we have to place the urinary catheter to relieve the blockage. So it's like a whole thing. So yeah. I'd rather, if we have a male cat that's straining, and sometimes they're straining because they just feel like they have to go and there's not really much in there, but I would rather check one of those and just at least take a feel of his belly and make sure his bladder is small and make sure, rather than blow off or wait on one that, they can potentially block and then they can die, and that's bad.
It was
That is true.
really bad.
That was a good idea. Good job.
Yeah. Look at me go.
Look at you go. You
Yeah.
know things.
And it was an issue. The owner went out of town, and the cat got really stressed and
Yep.
Yeah,
Yep. I can do
had
that.
issues. So
Oh, good. So let's talk about your prizes.
yeah. So we didn't get 5 shares this time around, but we did say we're going to do the car hanger thing. So I
Air
just brought
fresheners.
air fresheners.
That's the word.
Yeah, car hangers. But they say,
I know.
it says candle for the car.
It's weird.
But
Okay.
anyway, I just brought out these 2 because I really like them. So there's this one's clothesline fresh and creamy vanilla. You can pick. We've got 4 to choose from. So we're going to do the drawing.
The drawing.
The drawing.
Cool.
Okay. So I'm gonna have to get up close. Let's see. Oh gosh. Let's see. Okay. Let's see. Who's it gonna be?
Who is it? Is it thinking?
Diana Wellman.
Yay!
You
good job,
are the winner.
Diana.
Of an air freshener.
Like, dang it! I wanted a candle.
Well, if you want a candle, you guys just remember, comment that you shared it. You need to share it. And then comment that you shared it
Yeah, so we can see that.
so that we can see.
For sure. But yeah, so you could, and if she wants that candle, she can just keep sharing. That's okay.
Yeah.
You're not like out of the running for future
No.
ones or anything
Nope,
like that.
we'll just keep re-entering you.
Keep going.
So,
it's fine.
yeah.
So you get the big prize.
That's right.
Let it
If
ride.
we start getting like a bunch of shares, I'm going to have to come up with something else that you can give away. Like 15 shares, maybe they get a free car.
A free car. Oh, dear Lord.
Just kidding.
Oh,
It'll be like a
man.
little Hot Wheel.
There you go. Yes, that's what's in my budget. It's like here from the dollar store. I got you this little car.
You're like,
Yay.
no, I'd rather have the candle.
I don't blame them.
Yeah, me either.
All right. Well, we will see you all next week. We'll come up with another great topic. And
We're going to start, this is going to be our,
we're going to
what's
try.
the word I'm looking for? Like a motivator. Like a backup person. You guys are going to be in charge of keeping us on top of this. We're going to start posting what we're going to talk about the next week.
That's our goal. I have
Yeah.
a list. I have a list of things.
So that if you can't be here with us for the live video, you can still comment
yeah.
questions that you have, so that we can be sure to address those, and then we'll call you out and let you know that we've answered your question.
Sounds good. All right. So we will see you all next week. Have a wonderful rest of your week. Bye. That was a long one.
I don't think I ended it.
I don't think you did